Good morning and welcome to another special edition of Inside Story. I'm Tamala Edwards, and yet again, we're focusing on COVID-19. And what we're looking at this week is the fact that a lot of things are about to open up. In Philadelphia, parts of Pennsylvania, they're talking about moving into the yellow phase. We're hoping for that. And also there's some openings coming in New Jersey and in Delaware. So what does it mean for you? What's the best guidance? Let's introduce you to our panel. First up, a face that you know, an old friend, registered nurse and Action News reporter Allie Gorman. Good morning.
Hi, Tam.
Good morning. And we're also glad to welcome Michael Lavasser, a professor, I should say, at Drexel, who focuses on epidemiology. This is his wheelhouse. This is what he knows. So guys, let's get going. Allie, I'm going to start with you. People here, we're going to the yellow. They kind of wonder, what does that mean? Does that mean I'm still cautious, that I can start opening up, changing my thinking about what I do? What do you think for yourself, and what's the thumbnail that you're giving to friends and family and other people?
Yeah, Tamla, I know people are eager to get back to normal, but I will say yellow is very far from normal. We don't want all the wheels to come off. We still have to take precautions. Even though we can't see it, the virus is still very much out there. It's still circulating. So I'm telling people that, yeah, you can do a few more things, but you want to keep doing these precautions, socially distancing yourself, hand washing, wearing a mask when you can, and then a big one, avoiding large crowds, avoiding crowds. So you can visit a few more people, but if you're going to visit people outside of your own household, then I would do so outside, and I would still maintain that social distance. And then for people who are high risk, I mean, keep in mind that you really still want to be very, very cautious, because we are definitely not out of the woods at this point.
Michael, what are you telling? I would imagine a lot of your students, a lot of your other professors say, this is what you do. How do I look at this?
Yeah, and it's a lot of what Allie just said. A couple additional things that I'm recommending is first of all, to really limit the size of your social networks. So there are some people that, they have like 3 or 4 group of friends. Try and limit the number of people that you're spending time with, because you don't want to cross-contaminate across those networks. And in addition, I think it's a really good idea as we move into more of a contact tracing phase of our public health response, to keep a record of the people that you're spending time with and the days that you're spending time with, because in the event that you do become ill or you're contacted by as a result of the contact tracing efforts, you want to be able to tell the contact tracers and the health authorities who you've been spending time with and when, so that we can get a really good, strong handle on our response as we open up our communities.
Well, how do you do that? Do you just have a notes app on your phone? You keep a little notebook? How do you keep a running record? I know this time, I can't remember what day it is, maybe what meal it is. So keeping up with what's going on, how do you do it?
Yeah, I mean, an app on your phone, just contact, like writing down notes. It's really the people that we're spending time with. It's really the close contact for at least 10 to 15 minutes. So it's not necessarily someone that's running past you that I'm concerned with.
All right, good to keep in mind. And Allie, I know something you wanted to talk about, that when people get exhausted and fatigued with the restrictions, you want them to remember the phrase second wave. Explain what that is and why we should keep that in mind.
Yeah, I think we've heard over and over again from infectious disease experts that it is very likely that we'll see a second wave. At first, they were saying kind of expected in the fall, but at this point, they're saying, you know what, expected at any point. As restrictions start to get lifted and people are doing more, we could see little blips of outbreaks. And what Michael was talking about, the contact tracing, if that is not working, then we could start to see those numbers just start to rise. So I think they do expect to see a second wave. The question is, when will we see it? The more precautions we can take and the more testing and the more contact tracing, then the better off we're going to be to kind of isolate these cases so that we don't see the cases start to rise and start to see a surge. I'm definitely nervous about the fall. I'm not sure exactly what's going to happen, but I think we can expect to see a second wave, and we just need to do everything we can to try to prevent it.
You know, Michael, I keep hearing people have conversations that essentially boil down to calculated risk. They're tired of all of this, and they say, look, I'm not in a senior center. I don't have a compromised immune system. I'm not a person of color who may have a comorbidity. I don't have to be as focused on this or as nervous. What do you say to those people?
Well, I mean, one of the biggest issues with this virus is the pre-symptomatic or the asymptomatic transmission. So you may not know you're ill, and you may not have a serious course of disease, but certainly people in your community can become infected as a direct result of your actions because you've infected someone else and they've gone on to infect someone else. The issue with infectious diseases and especially respiratory diseases is they really take advantage of those things that make us most human, our desire to connect, our desire to be in close contact with people. And so, be able to balance the risks against the benefits of spending time with people, that's going to be something that we're all going to have to become very comfortable with doing.
And Allie, it feels as though the disease is always changing. Now we're hearing about more and more young people showing up in the numbers. So it feels as though people shouldn't assume about who can and does get sick with this.
I think that you cannot assume anything about this virus. As the weeks have unfolded, we have learned more and more. We started with very little information, and we still don't know everything about it. At first we were saying that it was just the older and the high-risk population, but there are perfectly healthy young adults who are getting very sick, ending up in the intensive care unit, and we don't know exactly why. So I think that everybody needs to be taking the precautions. Don't take anything for granted at this point.
Okay, so let's get into a little bit about the ways in which this disease can be transmitted. Let's start with airborne. We've seen a lot of the studies that show you can just be sitting at a table in a restaurant, and if you're in the wrong spot where the air conditioner is flowing, if there's not good ventilation, good luck to you. There's a better chance that you're going to get it. A lot of people are going to be told we're in the yellow, you got to go back to work, you need to go back into certain businesses. Michael, what advice would you give them in terms of looking at your workspace or assessing the risk or things that you can think about doing?
Yeah, one of the problems with the viral transmission that we're having is that we're still not entirely sure. And I think it's important to say that, I've been following this outbreak since very early January, and I'm still not sure what's happening. I've read a lot of the literature. I'm still pretty convinced that it's droplet transmission. There are other articles that have stated that airborne or aerosol transmission is more likely, based on some of the things that we're saying. And it's probably a mix between the two. And we know with influenza that we've been studying this for 100 years, and there's still not scientific consensus about which is the more important route of transmission, whether it's aerosol or droplet. So I would just practice the most precautions that you can. And I know CDC recently came out with guidelines for businesses and what they need to do, and that includes making sure that people are 6 feet apart, not having communal spaces, making sure that there's proper ventilation available. And some of this advice may change over time as we learn more, and we're going to learn more through the contact tracing programs, which is why they're really vital to the reopening opportunities that we're having right now.
And Allie, what are you hearing about fomites? Those are aspects of the disease that somebody who was sick, sneezed into their hand and touched a phone, touched an elevator button. What are you understanding about it, and what does it mean? Like, I see a lot of people wearing the latex gloves. Do you keep wearing the gloves? Is it just hand washing? What's the best practice?
Yeah, the gloves I have not been recommending from the very start. I know people were wearing them to the grocery store. It's very easy to cross-contaminate. So you're better off just, washing your hands well, bringing a hand sanitizer with you, wiping down the shopping cart before you go in and doing your shopping, and then coming out and using hand sanitizer. But just recently, I think the CDC got a lot of flack because people thought they were kind of changing their guidelines in terms of can the virus survive on surfaces. But as I saw it, they weren't really changing their guidelines. In the beginning, they were saying, hey, the risk for transmission is probably low from surfaces, but because we don't know everything, let's err on the side of caution and just make sure that people are disinfecting those common surfaces, which is good advice anyway, because we know that other viruses, norovirus stays on surfaces. So I don't think they were wrong in that. It's just that we're learning more. I think that the risk of transmission that way is low, but I think it's always good practice to disinfect when you can.
Both of you have raised wearing the mask and keeping some social distance. Want a little advice on that? Michael, I'll start with you. In wearing the mask, I think people are still confused sometimes as to, do I need to still do it, and when and where? If I'm in the park by myself, if I'm in my car, If I'm on a street, but people are kind of far away, but it's a busy city street, what is your best guidance on when and where to wear the mask?
Yeah, and on Tuesday I was out at the park by the river on Kelly Drive, and I saw a lot of people exercising out there wearing their masks, and people were, a good 20, 30 feet from one another um, when they're, just sitting on the grass by the park. And I think that was all really promising. With respect to the masks, a lot of it is going to come down to what are you most comfortable with. There's still a lot of questions about the efficacy of the cloth face masks, or what materials are best to be used for cloth face masks. So, the fact that there's this political conversation about face masks, and it's, a signal of your values, I suppose, gets really challenging for me as a scientist, because the science is a little bit unclear about the use of the cloth face masks. That said, it doesn't appear that it hurts to wear a cloth face mask, which is something that I was originally very concerned with, because cloth is absorbent, and it might increase people's risk touching their face and then pulling the mask down, and then causing transmission in ways that is very undesirable. But that's not something that we're seeing at the moment. So wear a mask when you are in crowded areas, but if you're just going out on your own, it's probably not an issue.
Okay, Allie, good guidance there on continuing to hold on to the mask. Another thing I hear from people is a little confusion. If I have a mask, does that mean I can stand 2 feet from you? Do I have to do social distancing and the mask? What do you tell people?
Now, the mask is just kind of a kind of second protection. You still want to keep 6 feet away from people. And remember, the mask is actually not to protect you. It's to protect people around you so that you're not spreading your germs to them. But that said, the more people who are wearing masks, then the better off that we could all be protected, because then we're more so keeping our germs to ourselves.
All right, let's go through some scenarios that I think people are common things that they're about to get into as we get into the yellow. Allie, I will start with you. Lots of people need that haircut. They want to get their nails done. They want to go to the gym. What are you telling them?
Yeah, anywhere that is crowded in a small space indoors, I would avoid. Nail salons, even though you're not with a lot of people, you're just kind of one-on-one with one person, you don't know how many people that person has been around, and you're face-to-face, and you're definitely not 6 feet apart. So I would skip the nail salon. I think gyms are really kind of pivoting their business in a smart way. A lot of them are now offering outdoor boot camp, and I think that's a good option. You can set up your own space away from other people. They're also doing the virtual workout so that you're just kind of in your home on your own, so you're safe that way. As far as the haircut, it's a little bit different than a nail salon, because typically they're standing behind you. I would say if you're going to do it, that you want to make sure that it is not a crowded salon. I know a lot of salons are kind of changing things around. You both want to be wearing masks. I would skip the hair wash. I would come with it wet and ready to go. Both be wearing masks. And then if you are in this high risk category, though, I would say that, I would hold off a little bit longer. I think at this point, it is not worth the risk of going to a hair salon if you can avoid it.
We will love you with the skunk stripe of a different color of hair, all the changes that we've all been going through. We'd rather you still be here. Mike, a lot of people have been doing takeout, carry out, come pick it up at the curb. Now they're hearing there might be outdoor dining or maybe indoor dining, some changes, social distance. Would you go out to eat at a restaurant in one of these scenarios now, or you're going to stick to takeout for now?
I'd stick to takeout. I mean, I don't think it's worth the risk, but my level of risk is potentially different from someone else's. And so, someone who really like going out to eat is a thing for them that's really important to them. Maybe that's something that they choose to be important to them. And we're gonna have to start making these calculated decisions. We're not going back to some semblance of normalcy. We're trying to, figure out for ourselves what activities we're willing to engage in.
Allie, for a lot of people, it's summer. They just had Memorial Day go by and they miss not seeing family. They miss the parades. They miss the weddings, the proms, all of that. And they want to know if they can get back to some of those gatherings. What do you say to them?
Yeah, I would piggyback off of what Michael said earlier about kind of limiting the number of people that you're around. I think family gatherings, if you want to do them, they have to be different. One, they have to be smaller. I would keep them outside. I would not share food. I would still try to socially distance between households, especially. As far as birthdays and weddings, that one's a little bit difficult because typically people are drinking, they're dancing, that brings people together. And really what you're trying to do is keep people separate. So I would probably err on the side of caution and push those off if you can.
Michael, you sing in a choir and you say that you miss it. And a lot of people, there's been a debate over whether or not they can get back to religious worship. They miss being able to do certain rites like funerals altogether. What's the latest? Are you going to pick up your songbook and try to figure out a way to get back with your choir, or you're going to give it a little bit more time?
We're definitely giving it more time, and I don't suspect that we'll be back as a group for at least a year. But we've been, trying virtual choirs. We're doing, virtual happy hours just to keep the group together. We've been in touch with each other through other, social media services like Slack. And so, it's been really great to stay in touch with this wonderful group of people. With respect to the religious services, I know that there was a May 22nd press release from the Philadelphia Department of Health, or from the city, that discusses some of the options that are available for, religious services and for grief counseling groups that are available on the website for the city. So I would definitely check those out if you're interested. But I think it's still far too soon to be holding services. So I just stay away from any group setting right now.
And a lot of churches and temples and other religious houses are doing things online. So it sounds like you might look into doing things that way until it's a little safer to all come together. Allie, a lot of people have shifted their exercise to outdoors, but then there's been concerns about that. If you're a biker, if you're a runner, what are you telling people about exercising outdoors and the best practices?
I think outdoor exercise is going to be great for your physical health and your mental health. I've been telling people if you can find an area that is less populated than the city, then I would go there. Even if you're driving out to the suburbs and just going for a neighborhood, I would do that because then you don't have to wear the mask. I think anywhere that you are somewhere where there are a lot of people, then you do want to be wearing the mask because you can't keep 6 feet distance from everybody. I will say the risk of transmission is low at that point, but it's possible that someone could sneeze or cough, or you could sneeze and cough right at the time that someone is passing by you. The risk is low, but if you can find an area that does not have a lot of people, then I would do that.
Mike, a lot of people read your Philly Magazine interview. That's how I found you, talking about summer camp, because that was a question that I had. Is it safe to send my kid to summer camp? And it's been a few weeks since that came out. I wondered your latest thoughts and guidance on that.
I don't think much has changed since that interview. I know that we're still ramping up our contact tracing efforts here in the city. And that's really going to be key to me being comfortable, going back to doing anything. It sounds like the city has officially closed all of the city pools for the summer. And so it looks like the city is starting to put out guidance about what these things can look like. But nothing has really changed for me in terms of my recommendations. I still think it's safer to stay at home and to limit the size of even your children's social networks. If you wanted to have, a couple of the neighborhood kids over, a couple of days a week to play in the backyard and have like one smaller group of people who aren't necessarily, going out and spreading to other networks, I think that's fine. But, the issue of, a large number of children gathering at the same time, I think it becomes a bigger concern.
And you pointed out in the article, it's a great thing if you can do it. Some families can't. Some families need the kids to go somewhere because they've got to go back to work. Anything you would tell somebody who's in that spot? I wish I didn't have to, but they do. Something they should do with their children?
I wish I had some advice in that situation. It's a shame that we potentially don't have the support in place that we need to really reopen safely and have these opportunities for the children in the summer. I assume that there's going to be guidance put out for that. I'm not aware of it at the moment, but daycare programs are reopening in the yellow phase, I believe. It's been a few days since I've looked at the descriptions of the phases, but if those are an option, if that's what you have to do, then go for it. But in terms of how to take care of your child in that situation, if they come home, I wouldn't treat them differently, but make sure that they know about the hand washing and wearing face masks and whatnot.
Okay, and finally, summer for a lot of people is about vacations. It's about going down the shore, up to the Poconos, getting away. Any advice, Allie, on how people should look at that? Just pop a tent in the backyard if you can, or is there still something you could plan to do? Like, what are you telling people in your circle?
I think for right now, I'm saying hold off just for a few more weeks. I'm interested to see what happens in the next 7 to 10 days, just based on people's behavior in the past 2 weeks, to see if we start to see the numbers creep back up. I think if you're traveling as a household, the people that are already in your household and you're going to go somewhere to the shore, the Poconos, and you're going to another home, I think that's okay. I wouldn't get on a plane. I definitely would tell people, unless you absolutely have to, I would not get on an airplane right now. But if you're going by car, going into another home, I would wipe down those common surfaces and then limit the amount of things that you're doing. If you can just be outside as a family, then that's great. But if there's some sort of festival that you're used to going to and they're thinking of opening it, I would avoid that.
Michael, you said your personal words are outdoors is better than indoors for everything, but to consider it that way. And it sounds like a lot of people are thinking that way. They're going to get in the car. They're saying a lot of people are looking at, can they go camping? Can they go into a state park and get away from everybody? Any advice on how to do that safely?
Take me with you. No, yeah, I think what Allie said is right on the hit. She hit the nail on the head. Whatever the phrase is, but the idea of doing it with a small group, don't go with larger groups. The outside, so far as we know right now, is safer than inside. We indoor transmission outdoor, but camping is probably totally fine. But do the same thing that you would do if you were just going to the park on a normal day. Maintain a distance from people if you're going to be in a crowded area. Wear your mask. But just avoid being in crowded areas in general. I wouldn't do anything differently on a vacation than I do in my normal life.
All right, guys, I think we went through a number of scenarios, so hopefully whatever somebody was concerned about, I think you hit a lot of the areas. So thank you. I really do appreciate all the advice and all the help, and hopefully one way or the other we will continue to be creative and make summer 2020, the yellow phase, as good as we possibly can. So thank you again to Allie Gorman and Michael Lavasser. And thank you to the viewer for joining us. We hope that we have helped you, and we'll see you right back here next week with another special edition of Inside Story.